There's more than 1,600 people attending this year's 2013 Public Health Preparedness Summit, and I had an opportunity to talk with Conference Director Jack Herman.
We started out by opening the conference with a panel of public health, healthcare, and behavioral health representatives from Aurora, Colorado, who were talking about the mass shooting that occurred there last July in one of their local movie theaters. We heard from some public health and healthcare representatives who are involved in the Hurricane Sandy response from a hospital perspective, and heard a little bit more about where we need to be focusing our attention in preparing healthcare facilities for future disasters and public health emergencies. We have over 1,600 people who've come in from all across the nation. We have a number of countries represented as well, so this is the first time we've had such a large international contingent that we're proud of, and hopefully that's a sign of the future to engage our international partners. I think it's important that we make sure that communicators are integrated into the work that we do at the state and local level, and how important it is to prepare those messages and understand who we're going to be communicating with and what tools and resources are available to you to enhance that communication to ensure that the right message is getting out to the right people at the right time.
We're trying to bring in the concept of social media and how it plays and will play in the future on our jobs. You know, what actually is social media? How can you use it? We're actually going to go ahead and do an interactive exercise session here in the afternoon to have people get on Twitter and Facebook and things of that nature to go ahead and utilize social media in more of a controlled setting, so that they can kind of get an idea of how to use it with not having to have that pressure of a disaster in front of them.
We have 7 different computers. They're all right now just set up on the Yahoo page until our participants come in. But what we're going to do is we're going to have a Twitter feed set up. For each one, it's going to be a different organization, and each group is going to be a different organization. So the scenario is a hurricane's hitting the Gulf of Mexico and Florida, so it's hitting Collier County. So we have Collier County Hospitals, Collier County Public Health, Collier County EMA. I set up fake Twitter accounts for all of them, made them all private, and then made them follow each other. And then I also set up fake user accounts. So there'll be different users through a news source, just different random people, somebody that loves movies, somebody that just is a stay-at-home mom. They're going to be tweeting about the disaster, and then the official sources have to come in and respond. It's a new tool for them to use. So a lot of people are used to just seeing news sources or being in front of the camera, but before you even get in front of the camera, social media is already happening. So it's just a way for people to learn hands-on how to use it and how they should be using it when they go back.
The people who are actually doing the job understand what social media will do for them and how it would help. But of course, as you go up that, if you would, that food chain to those leaders inside those departments, it gets a little, a little uneasy, because there's policy issues and liability concerns and how do we actually use it, and there's budget concerns. So really, I think the ceiling right now is those leaders and having them understand that this is something you really need to get into. You have to figure out how to do it. There's not one cookie cutter way of implementing this type of program, if you would, or these tools as we call it, but you need to figure out what works for your department and implement it, because it is powerful.
Everybody has a cell phone. Everybody's on their cell phone, on their internet. In the middle of a disaster, they're tweeting, they're sharing information. So public health needs to know that they need to get on that, and they need to get ahead of it so they can share their own information.
We've let the genie out of the bottle. So we're going to have to deal with this from now on, so get used to it. The old way of doing media presentations is not the way it is right now, and definitely won't be in the future.
That's our update for now. I'm Kerry, Shearer for NPHIC at the Public Health Preparedness Summit.